Okay. Good morning, all dear participants. Welcome once again in the 21 days national refresher course on the current developments in veterinary and fisheries sciences, jointly organized by the Rajwas, POFOS, and NADCL. So today we have the valuable resource person for enlightening the advances in veterinary diagnostic imaging, Dr. Parveen Bishnoi sir. So on behalf of organizing secretary of this national refresher course, from the participant side also, I would like to welcome Dr. Parveen Bishnoi sir. And before starting his presentation, uh, I would like to deliver a brief introduction of him. So Dr. Parveen Bishnoi sir is presently working as a uh, professor and head of Department of Veterinary Surgery and Radiology. And along with this departmental charge, he is also bearing the charge of the director clinics of Rajuas. And Dr. Praveen Bishnoi sir has the very good academic career during his post-graduation era. Sir has achieved the junior and senior research fellowship from the ICR, and he has also served for the animal husbandry department for a long period of 16 years as a renowned veterinary officer and veterinary and surgeon as well. And uh, in the contribution of in the research side, sir has also worked for has been also working for the as a PI, All India Network Program and on diagnostic imaging and management of surgical condition in animals. And beside this, sir is also is working as a PI of the Center for Disaster Management Technology for Animals. And sir is beside this, the research contributions is there is also serving as a some contributing for the administrative work also, like also work for the DSW Rajuas and University Coordinator Internship Rajuas Bikaner, and also working for the Chief Hostel Warden. And sir has also published the more than 200 articles in national and international reputed journal, and also is a part of the different societies as a life members. And sir is also acting as a assistant editor of the renowned Journal of Camel Practice and Research. So after a brief introduction of Dr. Praveen Bishnoi sir, I would like to request to Praveen Bishnoi sir to start the presentation and address the delegates, sir. Dr. Praveen Bishnoi sir. Over to Dr. Praveen Bishnoi sir.
Amit, please give me 5 minutes. I'm.
Yes, sir.
I have some urgent work. I am addressing you within 5
Okay, sir.
minutes.
Okay, sir. We will wait, sir. Yes. Dear participants, please stay online. I think sir has an important task. So let's for rejoining in.
Dr. Prakash, sir. Hello. So can you share your presentation? So please share your screen. इस स्क्रीन तो शेयर किया है. So please start the slideshow. Perfectly fine. Okay, so please continue.
तो आप दे दीजिए आप, ठीक है। अभी मैं थोड़ा इसमें कर रहा हूँ, आप दे दीजिए, वो बैटिंग दिलवा दो।
सर जो कह रहे हैं वो बिल
Am I audible?
Yes, sir.
And screen is showing?
Yes, sir.
Yes, sir.
Okay. Good morning to one and all, and thanks to the organizers for giving me this opportunity to deliver the lecture. And as the topic suggests, it is a very important topic, particularly for the clinicians and other veterinarians, either working in any teaching hospital or university, or even in the field or private veterinarians, because and this is the era of imaging. Without imaging, we cannot reach a definitive diagnosis in any case, whether talking about the small animal or large animal or wild birds. Every animal, we have to reach a definitive diagnostic, and for that, diagnostic imaging is playing a key role. And the recent advances, the science, particularly the biomedical science, it is very fastly growing, and it's the days are not very far when we were only dependent on the X-ray, and then came the ultrasonography. But nowadays, any modality which is our counterpart, the medical doctors, medical professionals, they are using the same modality, are being used in veterinary diagnostic also. And nowadays, the routine diagnostic modalities we are using, besides the X-ray, they are ultrasonography, which also include the color Doppler echocardiography, and then cross-sectional modalities like CT scan, MRI, then nuclear part, that PET scan or SPECT scan, then sometimes the dual modalities like PET and CT, PET and MR, or SPECT and CT, they are also a combination of the modalities are also being used. So they all these modalities, they have become widely available, and available to most of these centers, not at the grassroots level, but at the say for example at the teaching veterinary hospitals, or at university levels, or at district levels. Most of these modalities, they are available, and also in some cities, if these facilities are not available with the veterinary hospitals, the private the private laboratories, they are providing these facilities, or they are doing this scan for animals also. Earlier, they used to refuse even X-ray to the pet or other animals, but now they are readily doing this scan. Even the CT scan is being performed by some private labs at centers like Mumbai, Chennai, and Bangalore, all these. So you all have to be updated with the knowledge for interpretation of these modalities. Particularly the ultrasonography, it has become so common that even the district level hospitals of the animal husbandry department is having facility of ultrasonography, and people are becoming more and more demanding. Whenever a person come to you with the its animal, and he says that do whatever you want, and he is ready to pay whatever amount is you are asking, but he wants the accurate diagnosis and the exact treatment of his animal, because the valuable animals are becoming more and more valuable. If we talk about the large animal, the cattle and buffaloes, they are nowadays, the values of these animals are increasing by like anything. And similarly, more and more people are engaging engaging with the companion animals, and due to the change in the social structures, more and more people are now rearing the dogs and cats and even other animals also. So, and they are very affectionate with them. They are treating them as their family member. So they want to get their animal treated at any cost. So we all have to be updated with the current knowledge of diagnostic imaging. So these are some modalities which are available in veterinary science, and in India also. The not MRI, but up to CT scan are available at many centers. Now, besides the modalities, now the record keeping has become very easy, and due to the DICOM and the PAC system, the once any image is taken, it is readily available to different sources, and by mutual transmit or mutual sharing of these images, one can get accurate diagnosis, one can get help of the a senior person or another expert who is sitting at a distant place. And due to this back system, we can store the images for a longer period and in a very digital or very accurate and well classified manner. And whenever in later when we want to retrieve these images, we can retrieve these images with the click of the computer. So the diagnostic imaging has gone beyond the production of images only. Now we have option to display post taking process, then record, then store, retrieve, and transmission of the stored images. So this is another advancement in the with the diagnostic imaging, the PACS. This is picture archiving and computing. So, in the clinical context, the imaging is generated equated to clinical application of imaging techniques, which includes X-ray diagnostic, which employ the ionizing radiations, then projection radiography, that is also X-ray, fluoroscopy, it is also X-ray, computed radiography, again, this uses X-ray, and then digital radiography, computed radiography, computed tomography, then MRI, ultrasonography, endoscopy, all these, they are considered as the various modalities of the diagnostic imaging. Okay, then there are advantage in each section. If we talk about the X-ray diagnostic, normally the X-ray diagnostic techniques, they differ from each other with the advancement from the normal radiography to the computed radiography and digital radiography. Now this is the traditional X-ray and simple X-ray machine. And traditionally, I don't know how many of the participants, they actually have witnessed this development process. When the days, if some senior persons are sitting there, they must be knowing that we used to take the X-ray on in a X-ray film. Before that, we have to go to the dark room, then under the red light or dim red light, we used to load the cassette with the X-ray film, and very carefully then we came out and expose, and then again go to dark room, then develop it, fix it, wash it, dry, and then only we were able to see the image. And many a times we have to repeat the X-ray, and this process, they increase the exposure to the animal as well as exposure of the radiographer and other personnel. So this was the earlier this process we used to, but now this has been replaced by the computed radiography or CR system, where we take the image in a plate, and we insert in the image developer, and the image is displayed on your screen, and you can modify it, or you can reconstruct it, or you can process it at the computer screen. Computer will do all these things for you. Do you need not any developer, any fixer, any darkroom is not required. So, and another more advanced is digital radiography, where as soon as you click the X-ray, the image will be displayed on your screen. So these are the advanced features. And at our Rajua's Bikaner department, we are fortunate to have all these advanced features. We are having this CR system, then digital radiography system for large animal, 1000 ms X-ray machine, then CT scan. We are having advanced high-end ultrasonography. So this is the difference between computed radiography and digital radiography. Although this is a theoretical part, but we must know what is the CR system and what is DR system. In computed radiography, a cassette is used with the phosphor plate that is scanned to create a digital image. Then CR uses a cassette containing a phosphor plate, and when this plate is exposed to the X-ray, the image is stored in that phosphor plate, and when we insert this cassette after exposure into the CR reader, the image will be displayed on the computer. While in digital radiography, a flat panel detector is used, and this detector, they directly capture and display the digital image on your computer screen. You need not to use a cassette or insert that cassette into a CR reader. Directly, as soon as we press the button, the image will be shown over the computer screen. And if we see that the image is not informative, we can immediately redirect, or we can take another image. So the time has saved. Also the exposure, we can modify, or we can process the image on computer. Otherwise, in earlier days, sometimes there were overexposed, sometimes they were underexposed, overdeveloped, underdeveloped. These were the problems with the routine radiography. Now, another advancement is the fluoroscopy. Although fluoroscopy has been used since ages, but the recently the form in which the fluoroscopy is being used, it is in the form of C-arm X-ray. C-arm X-ray is routinely being used for various operations, like mainly with the orthopedic operations, or FNSC aspiration, or biopsy of internal organs. Then in orthopedics, to ensure the accurate immobilization or alignment of the fragments, then close reduction and position of implant, intramedullary implant, or whatever we are using, it can be immediately visualized on the screen. So we need not to reoperate the patient if the implant is not accurately placed. We can immediately see and then adjust our implant or the fragments. Now, ultrasonography. This is very important modality. It has revolutionized the veterinary radiology application. It is a non-invasive diagnostic tool, and it is capable to produce real-time images of the internal organs, soft tissue structures. And it is particularly useful for examining the abdominal and the heart, as well as for the reproductive management in wide variety of the animal species. And it is probably the second most commonly used modality after the X-ray. And as you all know, the ultrasound, it uses the ultrasonic waves, most commonly in frequency range from the 1.5 megahertz to 18 megahertz. So with this megahertz frequency, it displays various organs. Depending on the location of the organ, we use different transducers to image the organs. Now, as far as the functioning of the ultrasound, a sound wave is produced by the transducer, and this ultra short pulse of the sound is directed to the animal, after which the transducer switches to the receiver mode. Once the transducer produces a sound wave, it will go into the body, and then it will strike the internal organ. Some of the sound wave will be passed, some will be absorbed, and some will be reflected back. And then the same transducer, it will become a receiver, and then it will send the signals to the computer, and the computer will display the, on the basis of the pulse echo principle, it will display the image on the computer screen. Now this is a dog being scanned by the for the ultrasonography. And in the below picture, you can see this is urinary bladder having some hyperechoic image here, and this is kidneys, calyces, and are very clearly visible. So although there are some limitations, earlier some limitations were faced by the earlier researchers, that they could not, they saying that the GIT tract cannot be scanned by the ultrasonography due to presence of gas. But nowadays, with the advancement of the techniques and advancement of the equipments, now the each and every abdominal organ, every thoracic organ can be imaged by the ultrasonography. Even the musculature structures, tendons, and all other structures, ocular ultrasonography is becoming very popular nowadays. So this is very useful modality. And now this is what we have got at our center. This is very advanced machine of ultrasonography, which is capable of doing all the color Doppler and other elastography and other features are also present in this. And ultrasonography, it can also be used to detect, to direct the biopsy instruments to acquire tissue for specific pathologic diagnosis. We need not to go for ciliotomy or laparotomy to take a biopsy. With the biopsy gun, with the help of the ultrasound guided, we can take biopsy from any internal organ, whether it be liver, spleen, or any other organ. We can take direct biopsy with the help of this. So it is very safer. And earlier we used to take blind biopsy or FNAC, but now with the assistance of the ultrasonography, we accurately can take biopsy for the further investigations. Now, echocardiography is the ultrasonic evaluation of the heart, and earlier it was being done using M-mode format of displaying ultrasound information. The M-mode examination has been coupled with now with the real-time B-mode studies to improve the accuracy of the beam placement and add additional information such as shape of the chamber. Then ultrasonographic images are also used to acquire quantitative information about the cardiac function. Then measurement of the specific parameters can be made on either the M mode or the two-dimensional B mode. So as you can see that this is the transducer, a cardiac transducer. I have highlighted these. One is convex transducer, other is the cardiac transducer, which is specific for the echocardiography. Now, another feature is color Doppler. What is color Doppler ultrasound? It is a non-invasive imaging technique that uses sound wave to visualize blood flow, showing both the direction and the speed of the blood movement. So, and which is displayed as color on the color image on the ultrasonography screen. So when it transmits into the body, and these sound waves bounce off back with the red blood cells and other tissue, creating echoes. Then the computer processes these echoes and displays them as images with colors indicating the direction, speed of the blood flow. Now, how can we assess the blood flow with the color? So the blood which the blood is flowing towards the transducer, it is typically shown into the red. And as we know that usually the arterial flow is coming towards the organ, and the venous flow is going away from the organ. So generally the arterial flow will be displayed in the red, and the venous flow will be displayed in the blue. Then the intestine of the intensity of the color can also indicate the speed of the blood flow. If we are talking about the heart, then the speed or this pressure of the blood with which the blood is flowing, that also be indicated with the color. If the pressure or the speed of the blood is more, it will be displayed in the bright red color. Otherwise, it will be displayed into the blue color. So then insufficiency, if valvular insufficiency or regurgitation is this, then the it can be very well detected with the color Doppler. Then if there is stenosis, and due to that stenosis, if the velocity has increased, or there is abnormal blood movement between the vessels or elsewhere in the body, that can also be detected with the help of the color Doppler. So in color Doppler is used to detecting blockage and clots, assessing blood flow, monitoring pregnancy, and then diagnosis of other conditions also. Then the contrast agent can also be used. Earlier, the contrast agents were used for X-rays only, but for the contrast radiography. But nowadays, contrast agent has been routinely being used in ultrasound also. So ultrasound contrast agent, it increases the reflectivity of the blood and any tissue through which blood flows. So enhancement of blood reflectivity is usually accomplished by injection or formation of transient microscopic bubbles in the plasma. The increase in echogenicity is related to the amount of blood flowing through the tissue, and the bubbles are quickly absorbed into the plasma and therefore do not constitute an embolism hazard. The ability to evaluate the vascularity of a tissue provides additional information about the type of lesion present, and ultrasound contrast agents have had mixed success in improving the diagnosis sensitivity, and more research is need to be done so that it can become a routine procedure in diagnostic imaging for veterinary profession. Now, when we talk about the ultrasonography, always a question is raised by many of the students and many the veterinarians and others about the PCPNDT Act. This is very important act. You must be knowing about this act. Said this is a preconception prenatal diagnostic technique act. Although this act is made for the human beings and to prevent the female feticides and other things. So this preconception and prenatal diagnostic act 1994, it is applicable to veterinarians also. Okay, so along this act, along with its amendment in 2003, any veterinarian who is dealing with the ultrasonography, he must have a copy of it. It can be downloaded online, and also various alterations as per your state regulatory boards or state authorities, you should also know, and we should act accordingly. So this is the letter of Government of India, Ministry of the Health and Family Welfare, PNDT section. This letter is of 30th September 2016, and it was sent to all the state authorities of animal of health and family welfare and all the state animal husbandry departments, and they were directed to circulate among all the veterinarians. And in this letter, the government of India, Ministry of Health and Family Welfare authorized veterinarian to perform the ultrasonography on animals and to use the ultrasound machines and other equipment or technologies capable of undertaking determination of the health of the fetus. So this is the letter I have uh, enhanced or rewritten it, and in this it is mentioned that such veterinary doctors who are allowed to use the ultrasonography or ultrasound machine, they must hold a recognized degree in the veterinary science as included in first schedule, second schedule of the Indian Veterinary Council Act 84, with short-term training in radiology. Short-term training in radiology means if the person is MBSc in surgery and radiology, he is eligible. Otherwise, if you are not MBSc in veterinary surgery and radiology, so you must do a short-term means 1 week or 2 week course on the radiology. And many institutes, almost all the universities, they are regularly organizing such trainings or training programs. Even Raju's Bikaner, every year we are doing this, and we are organizing such training programs in radiology and ultrasonography. 2 or 3 training programs are being organized, and this year also we are starting it from the month of September and later on. So any one of you who is interested, he can join this. He can register, or she can register online. Please visit our website of Raju's, www.rajuas.org, for further information regarding this time to time. Then that person who is who have acquired or who has procured a ultrasound machine, whether in the his clinic or whether in the government sector, he should seek a no objection certificate from the district officer of the animal husbandry. And then you should take keep a record of the scans you are doing at your center. Each and every you should maintain a logbook of your ultrasound machine, and each and every scan should be recorded in that. And then we have to send the monthly report to the PCP entity cell also, and this report should be should reach the PCP entity center before 5th of every month. So we are doing it very regularly, and all the machines we are having 3-4 machines are registered with the PCP entity act, and we are doing regularly all type of scans, and we are submitting reports every month, and we are maintaining the logbook also. So there is no problem in using this. Even portable machines are also allowed for the veterinary field, veterinarians, and you have to register that separately, that this portable machine for use in the mobile unit or for use for the farm animals or whatever it is, you have to seek a different registration or different permission for that. Now, next is computed tomography. This is the modality which is very fastly upcoming, and it has many advantages over the routine radiography. In routine radiography, we are getting a 2-dimensional image of a 3-dimensional object, and the main problem, even after taking 2 to 3 angle radiography, the main problem with the routine radiography, is that obscuring or superimposing of the images. But with the advancement of the CT scan, there is revolution in veterinary medicine, and it is the most valuable tool for imaging workup of orthopedic, neurological, oncological patients. Particularly till now, it is mostly being used in small animals. In India, we are proud to inform all the participants that we are the pioneer in the CT scan. We are the first to install the CT scan machine in any veterinary institute in India way back in 2016. And since then, the CT scan unit of Rajuwas is working very efficiently, and we have done many research in the field of canine and feline under the CT scan, and it was established under the ANP DIMSCA project, which is a very prestigious project of ICR New Delhi. So it has many applications in small animals, axial skeletal region or appendical skeletal region. Many diseases, disorders, vertebral column disorders, head disorders, and skeletal disorders can be easily diagnosed with the help of the CT scan. Now, what are the advantages? It uses the differential absorption of the X-ray by tissue to mathematically create a 2D matrix with pixels of differing gray shades dependent upon the absorption. Then to give cross-sectional information about the third dimension of an object, so that these pixels, they also give an information of the third dimension. Otherwise, in X-ray, we can get only information only of up to 2-dimensional. So that's why the superimposing of image is common in X-ray, and that hindrance can be overcome with the help of the CT image. So the thin collimated beam allows slicing through an object, avoiding the superimposition of the images of the structure. Superior contrast resolution of 4,000 shades of gray can be differentiated, and different spatial reconstruction along algorithm allow a preferential display of bony or soft tissue. So with our naked eye, we hardly can differentiate 8 to 10 shades of gray. But with the help of CT scan, we can differentiate 4,000 shades of gray. So this ability of the CT scan, this is very important, and it can very well separate the different tissues. It can separate fat from the subcutaneous tissue, and subcutaneous tissue from the muscles, muscles from the tendons, tendons from ligament, ligament from cartilage, cartilage from bone, and any abnormal structure if present in the body. So every single slice, CT slice thickness is substantially larger than size of each picture element. So you know what is voxel and pixel. So it slices the organs to different images. Let me explain in another way. You all might have seen the bread. We all use bread, and sometimes we see that the uppermost slice of the bread, it is perfectly all right, but when we remove 4 or 5 slices, we suddenly find a hole in the next slice, and sometimes it continue and it even become wider. So this is it. From the X-ray, if we're taking the X-ray, we hardly find to that abnormality. If that abnormality is in the organ and the CT scan is slicing like a bread, then we can accurately diagnose the defect in whatever location of that defect or that abnormality or any growth or any deviation from the normal tissue is there. The CT scan will be able to find out that, and we can give a definitely diagnosis of that. Then development, earlier the slip ring technology invention in the CT scan, development of CT scan has become more and more advanced. So then now the helical and multi-slice scanners are available. We are having here 16 slice CT scan, but nowadays in medical science 128 slice or more than that slice scanners are also available. Then software is also very much developed. Then this, with the help of software, we can reconstruct a 3D image of any organ, and we can move that also. So it is like that. We are holding the bone in our hand, and we can view all around it. So this is the advantage of the 3D models. So this is a schematic diagram, how the X-ray tube and gantry detectors are there. X-ray tube, a collimated X-ray fan-shaped beam will be released from the X-ray tube, and against it, the detectors are there. They will absorb, they will detect after passing through the body, and this gantry, this is rotating all around the patient, and so the 360 images they are taken. This is you can see a skull having some problems, and a 3D image of the skull is has been taken and developed, and you can see each and every part of the skull, and the darkened area, the which are which has a different color from the normal, they are deviation from the normal healthy bone. So orthopedic practice exact excellent modality for assessing the skeletal disorders. Okay, so this is first image, and second image you can see the X-ray of the iliac fracture, and we can appreciate that there is iliac fracture, acetabular and iliac fracture are there, but when we go for CT scan, then the exact the intensity and the what is the condition of the bone and what is the position of the fracture, we can more accurately appreciate. Now, the same picture, when we reconstruct it into a 3D image, the such image is displayed, and in the computer there, we can rotate it also all over, and we can see all around it. So every aspect of the bone or organ we can be visualized with the help of this 3D reconstructed image, and any lesion cannot be obscured, cannot be left without noting if we carefully examine the you can see the fracture and the dislocation are oblique fracture of ilium and acetabulum are clearly visible, and the star, it shows the comminuted fracture of the ilium, and the arrow, it also shows us the acetabular fracture. Then the basic requirement of the CT scan examination is the general anesthesia. The patient should not be moved, and we cannot ask our patients to remain stand still. So the general anesthesia is very essential while examining the CT scan, and you can see in all the three pictures that after general anesthesia, the dog has been secured on this table. This table will move in and out of the CT scan gantry, and there is no one present in the gantry room because of the high radiation area. We won't allow anybody, even the attendant or owner of the animal will not be allowed to stay in the gantry room. And from gantry, we all are sitting in processing room, and then from there, through a lead glass, we visualize and we scan the animal from there, and so the animal is secured in either in external recumbency or in dorsal recumbency or lateral recumbency, whatever the requirement is there. So we can take the images, although the machine will take all images, but later on, whatever plane we want to see, we can out of those images we can select that plane. And usually three types of planes are there, that is transverse, dorsal and sagittal plane. And the same planes in human radiology, they name it differently. The transfer plane is usually named as axial in humans. The dorsal plane is as coronal. Sagittal is same in both veterinary radiology. Now, as I told also that the density is measured in terms of Hounsfield units, which divides the entire spectrum of possible densities into 4,000 levels. That is from minus 1,000 to plus 3,000. Okay. So the air, air is considered as the lightest, or it is considered as having the minus 1,000 Hounsfield unit to the cortical bone, which is more than 1,000, okay, or a metallic object is present which will be above the 2,000 or 3,000 Hounsfield unit, okay. So value of air is minus 1,000, water is at 0, and lead is at 3,000. So this is the range, and it has been specified that what is the CT number in Hounsfield unit of different organs. Say for example, bone is plus 1,000, white matter is plus 20 to 30, muscles are plus 20 to 40, gray matter is plus 30 to 40. If there is hematoma, or it is plus 65 to plus 95. So that's why useful in head injuries. When there is a head injury, if there is hematoma or hemorrhage, it is very well differentiated from the brain tissue, that is gray matter, and it has more density than the gray matter. So it is clearly diagnosed with the help of the CT scan. Okay, fat is again less than the water. Air is, as I told, it is minus 1,000. So these are different standardized value of different organs: thyroid, liver, blood, muscles, pancreas, kidney, plasma, exudate, transudate. All these, each and every fluid, every tissue, every organ have its a specific standard value of the city value or Hounsfield unit. So by comparing these standard value, we can diagnose that whether the Hounsfield unit of a particular organ or a particular area or particular tissue is increased or decreased. Accordingly, we can diagnose the condition. Now, this is the window level setting. This is the bone window setting. There is provision of bone window and soft tissue window. If we want to see a bony defect, if we are suspecting a bony defect, then we will choose the bone window. Then the soft tissue will be obscured. And if we want to visualize a soft tissue defect or soft tissue abnormality, then we will select the soft tissue window. Then the bony tissue will be obscured by the machine, and we can visualize only the soft tissues. And accordingly, we can very well find out the any abnormality, any deviation from the normal in the soft tissue. And another modality is MRI, where the magnetic field is used instead of X-ray. And this is very popular and very common in human beings and in animals abroad. But in India, till date, no specific veterinary MRI unit has been established anywhere. But people are using this for the detection of soft tissue, particularly soft tissue defect, which are not diagnosed with the help of ultrasonography. They are being diagnosed with the help of MRI, and some labs are there who are scanning for animals also, and they are giving you scan, but you have to most of them you have to interpret by yourself. So these are the applications of MRI. It is a detect. It is very useful tool for neurologic, oncologic, and other diseases and musculoskeletal disorders in animals, and angiography, spectroscopy. These are another applications of the MRI. And nowadays in ophthalmology also, the to detect the any orbital disease or any defect in the eye, the MRI is being used with the along with the measurements, different measurements. Although ultrasonography is also a very good tool to give the ocular biometry, but this is more precise. So it is also safe. But if the safety procedure is broken, then sometimes some accidents you might have heard or seen that if some metallic object is present in your body, with your body, on your body, or with the handler, then the accident may occur, because in this modality a very strong magnet is used, and that attract any metallic object present. So the room is specifically designed to install the MRI, which is devoid of any metallic object, any metallic insertion is there. Another upcoming modality is photoacoustic imaging. It is upcoming modality, and this photoacoustic imaging is a promising non-invasive imaging technique in veterinary medicine. It combines high contrast optical imaging with high spatial resolution ultrasound imaging. So it uses light to excite tissues, then generating sound waves, and that are then detected and processed to create images, providing valuable information about the tissue morphology. So how it works? And there is a pulse laser light is shown to the target tissue, and when this light is absorbed by tissue, it generates heat, which causes rapid thermal expansion and contraction, and produces the ultrasound waves. That is photoacoustic effect. And these ultrasound waves are then detected by ultrasound transducers, which are then processed to create an image over the computer. So this is the latest technique which is being used in the veterinary field, particularly to detect any tumor and any growth in the body. And the benefits of PI is high resolution and depth. It is real-time, long-term monitoring, functional imaging, molecular imaging, then non-ioning and non-invasive. Another, because we are using only laser light and ultrasound modalities. Both are non-invasive. So this is a non-invasive technique, and it don't require much of the protections as the CT scan and X-rays. It can be used for cancer imaging, cardiovascular imaging, general anatomical and functional imaging, inflammation imaging, skin imaging, and even with for the photothermal therapy of the different lesions. So with this, although the this field is very vast, we cannot uh, include all the things in one lecture or one sitting, one discussion. So I tried my best to uh, get you acquainted with the latest techniques which are being used as diagnostic imaging techniques, and the future of diagnostic imaging in veterinary medicine is characterized by rapid technological advancement, particularly with the increasing integration of the artificial intelligence and advanced modalities. And in near future, we will see that the AI is being used with the any type of the diagnostic modalities. You have just to click the image, and the computer will itself give you the a possible diagnosis, and it will suggest you about the possible conditions and outcome and all these. So this is use of AI is day by day increasing in all the modalities, and this evaluation promises enhanced accuracy, efficiency, and accessibility in diagnostic, ultimately leading to improved animal health outcomes. And we, the veterinarians, will be able to more accurately diagnose and more accurately treat the patients. So, key trends and technologies are artificial intelligence, advanced imaging modalities, then teleradiology, image mapping and functional imaging, veterinary PAC system, and collaboration and data sharing. And we all should share the images, and we should move by placing hand in hand for the betterment of the animal health, for the betterment of the mankind, because as the one health, we all are interconnected. If our animals will remain healthy, we will remain healthy, our environment will remain healthy. And with this, I conclude this presentation. And once again, I thank all the organizing team for giving me this platform for this presentation. Thanks. And if anyone have any question, please ask. Thank you, sir.